we actually have quite a few examples of areas where there are no guidelines, and yet every day patients are making decisions about what they have to do with regard to their health care. And so, for example, there are straightforward guidelines about women who have BRCA1 and BRCA2 mutations removing their ovaries and tubes to lower their risk for ovarian cancer and for breast cancer. However, there's no guidelines about whether or not at the same time they should remove their uterus. And what we see is this is a question that women really agonize over, and they come to force for answers. They want to know, what should I do? Why should I do it? What are my outcomes going to be? And the reason there really aren't guidelines on this right now is that we haven't conducted the research to know what are the differences in outcomes in women who remove their uterus and women who don't. Because in general, the risk is for ovarian and fallopian tube cancer. So we did what we call an engagement survey to get a sense from our community about how they make decisions about their health care. And one of the things that we did is asked women who had already removed their ovaries and tubes whether or not they removed their uterus, and we found that half had and half had not. We asked them what were the reasons and the influences in that decision making, and what we found was that one of the biggest and most strongest influencing factors was doctor recommendation, which we find really fascinating because there are no guidelines there. So part of the research that we hope to conduct is then to determine what are the long-term outcomes for women who do remove their uterus and women who don't, so that we can inform this decision making based on outcomes, and rather than just potentially clinicians' opinions based on what they've always done.